This is our group task presentation for Social Work 4020 by Lily McKenzie, Melissa Crespo, and Shay Bledsoe.
Early adversity can significantly impact a child's development, learning, and long-term well-being. Adverse childhood experiences, called ACEs, impact people across their entire life. They include abuse, neglect, and exposure to violence, which affect development. Research shows more ACEs are linked to worse health and life outcomes.
Adverse childhood experiences are stressful or powerful events occurring before the age of 18. These can include abuse in the signs of physical, emotional, or sexual, neglect, household dysfunction, and exposure to violence. Research by Fetty in the early 2000s shows a graded relationship between the number of ACEs and negative outcomes in adulthood. Higher ACEs scores increase risk for chronic illness, mental health issues, and substance use. Understanding ACEs is crucial for social workers because early adversity affects the whole lifespan, including health and behavior. Children with higher ACE scores often show decreased engagement in school, more behavior problems, and a greater likelihood of repeating grades. This includes ADHD, aggression, difficulty regulating emotions, and social difficulties. These are short-term effects that can compound over time if they are not addressed. Early identification and trauma-informed support are essential to help children succeed academically and socially. Addressing these issues early reduces long-term negative outcomes. Social workers address ACEs with trauma-informed, prevention-focused, and equity-driven strategies, working both directly with individuals and families and advocating for systemic changes. At the micro level, social workers provide counseling, connect families with resources, and develop individualized support plans to build resilience. At the macro level, social workers advocate for policy changes, equitable access to services, and public health initiatives to reduce ACE exposure in communities. This work aligns with the National Association of Social Workers' value of service, social justice, and upholding the dignity and worth of a person, ensuring trauma-informed care respects individual experiences. When we're talking about the CSWE competencies, it's important to note what each of them means. Competency 1 is in regard to ethical and professional behavior. Competency 3 is all about advancing human rights and justice. And competency 7 deals with the evidence-based assessment and the promotion of resilience. Social workers apply these in all levels of intervention.
Some of the signs of ACEs include behavioral change. These include acting out, aggression, impulsivity, being excessively quiet and withdrawn. Physical signs include unexplained fatigue, headaches, stomach aches, or physical behaviors of neglect/abuse. Cognitive and academic issues would consist of difficulty concentrating, memory problems, and academic failure. Some of the social/relational ones would include fear of others, trouble forming relationships, and the difficulty of trusting adults. And emotional regulation, these include frequent fear, anxiety, outbursts, and difficulty managing emotions. Why ACEs matter. So higher ACE scores are associated with increased risk of physical health problems. These would include such as heart disease, stroke, obesity, and chronic lung disease. Mental health challenges are also a big part. This would include depression, anxiety, PTSD, and substance use disorder. The behavioral and social impacts of ACEs would have to include difficulty in relationships, risky behaviors such as smoking and substance abuse, and lower academic/work outcomes.
Trauma-informed support is essential to help children heal and thrive. In conclusion, it builds trust through consistent supportive relationships with caregivers and staff. It also uses strategies like emotional regulation skills and avoiding triggers to support healing and growth.